Often in your career, an opportunity will arise for you to do something, you'll be offered something, and your instinct is, oh no, I couldn't possibly do that. And sometimes you say no for that reason. So I think my advice would be, don't be afraid. I didn't choose it chose me. When I'd finished my undergraduate degree, I took a job for a couple of months working at the Bethlehem Hospital in London. It was kind of an audit role. And I'd been interviewed for a previous post and didn't get it. The consultant asked me if I would apply for a subsequent post that was coming up that was research, and it was working on a clinical trial. And that really appealed to me. So after 2 months, I ditched the job at the Bethlehem and took this one instead. And it was at St George's at University of London. And that's where I first met Paul Jones, who I worked with for nearly 10 years. And it was on a large multicentre clinical trial that was being run all across the UK. It was a really exciting study. I have this kind of image in my head of kind of surfing on a mountain of paperwork, because there was a huge amount of collecting data, which in those days was on questionnaires. It was kind of questionnaire based, and I think we had something like 40,000 questionnaires in the end, and I had to data enter almost all of it. I wouldn't want to go back and do that now, but that's kind of where I started, and it kind of where I started in data entry, and by the end of the trial I was one of the co-authors on the major paper that went into the BMJ, and that's probably because I was keen to step up to the plate. What I worked on predominantly was patient-reported outcome measures in clinical trials, and that's about trying to capture a patient's perspective about the impact of an intervention on their health, how it makes them feel. And one of the reasons why that's incredibly important, and why I was committed to it for so many years, is because how a clinician feels about you can determine the treatment you receive, but actually one of the things that determines your use of services or your health is how you feel. How you feel is what gets you to seek healthcare in the first place. So I guess I was kind of part of that movement of highlighting that in research and bringing it to research and making it a very important component of the research that we do to ensure that it has an impact on people and their health, the patients themselves. Paul Jones, who was a respiratory consultant at the time at St George's in London, was my original boss and one of the most inspirational people. Another person who worked for Paul at the time, so he had two areas of research. One was respiratory research, and the other one was evidence-based practice and Cochrane. So he had a guy who ran this Cochrane group for him, and his name was Steve Milan. We sort of met a bit at work, and I kind of got into Cochrane in kind of a major way because I married him. So that kind of really did lead me into Cochrane. I guess another person, I was at Brunel University after I was at St George's in London, and I met a researcher there called Geraldine Barrett. And she's one of the most ferociously good researchers I've ever met. She's now at UCL. And I have huge admiration for her in terms of being able to maintain and manage the career that she has in that incredibly high quality way at the same time as kind of managing family. So I guess I would probably say those people really. I think some of my best supporters are obviously family. Steve, who, when we moved to the Northwest, gave up his job in a very senior role at St George's, University of London, where he was working in the trust at the time, developing a whole evidence-based system for the trust and improving clinical practice. And he gave that up for us to relocate to the Northwest. And it took a while for him to get a job in this area. There are so many opportunities that I would like to capitalise on, to draw people in and to expand and extend that research in such a way that it has a genuine impact on healthcare practice. In my career, and that's even right from the very beginning of my career, I've been described as a scary person, as a scary woman in particular, by all kinds of people, men, women, older people, younger people. A lot of people have found me to be a scary person. And I think probably my advice would be, don't be tempted to fall into that masculinization of your role, where you feel that to be kind of a leader and to be taken seriously, you have to be kind of aggressive and angry and overly serious. I think being female is not a disadvantage. It's an advantage, and we can be kind of warm and approachable and known for being open and engaging. In my role as Director of Research at Edge University, I predominantly work with the Faculty of Health and Social Care, and just by the nature of the professions involved, the majority of them are women. They're women who, some of them do predominantly teaching, others are more actively research. But my role is to get them involved in research. I think research should be something that people who are passionate about changing practice and passionate about improving health should do.